Welcome. We're going to talk about the level 1 rapid infuser. Basically, it's a machine that can auto-administer crystalloid and blood at 1400 milliliters per hour. The level 1 is going to require a tubing set, which is the D100. Comes in with a heating chamber, a filter, and tubing to the patient, and 2 primers for the bag. So we're going to set first. We're going to set the heating tube first. So we're going to put the 1 into the 1. Then we're going to raise at 2 the lock, and we're going to push and gently seat the tubing and make sure that the tubing is locked. Right? We're going to close the caps, and we're going to lay this here for now. And we're going to take the tubing, making sure it's closed. We're going to seat the filter, there's a filter, into position 4. Now some model, and you just press on it, making sure both tubing is set free. Now some model has an air detector that may or may not work. The machine does not need the air detector, but if you have it, it's functional. You can turn your tubing, put your tubing in the case, making sure it goes into the chamber. You close your chamber. Close the chamber, and in this case, our chamber is not really functional. Alright, so you're tubing into the air exchanger. The air exchanger may or may not be provided in the machine. It may or may not be functional. If it doesn't work, you don't need to run it. You're going to clip it here. It's a little tricky. You're going to have to work. It's going to go up, and it's going to lock. Make sure this is locked. Out, close. And of course, we're keeping this sterile. Goes to the patient. Next, what we're going to do is we're going to prime our fluid. So we're going to open this, open, and open. We're going to use normal saline. And if you look inside you have hooks. 1 hook's here, another, and 3 hooks. This is depending on the size of your fluid. This is a balloon that will inflate. So the fluid needs to be seated within that case. If it comes out on both sides, you may rupture the bag. So we're going to put the bag, this layer sitting here, with the other one. Again here. All right, and we're going to close. Now I recommend that you prime that you get the fluid connected before. So both tubing close and close before, and then we're going to remove the blue cap. We're going to enter it, and you'll notice that you can't advance it that much more. Just need to enter, and then close. Close. We're not priming the chamber yet. I'm going to take a second one. And this can be in any combination. If it's a unit of blood, if it's just fluid, lactate ringer, saline. So now we have the two bags connected, clamps on, clamps off. So now we're going to prime the system. We're going to open the clamps. We're going to open the clamps. And if you notice, we're going to press the chambers, fill the chamber. And if you notice, the fluid is going to start coming, and until the fluid is all the way down to here, until the fluid comes here. So now we have our system here. We're opening it. And our tubing is primed. You can just, the moment you press this green button, you press on, it turns the fluid on. Now the water chamber needs to be filled with sterile water. And we're priming the fluid. You can see the fluid is priming, and then now we have the line primed. Once the line is primed, everything is running, the chamber is running, the entire line is primed. You can press the button right here, and you're going to inflate the chamber on both sides. And if you notice, your chamber is going to create pressure, 100 to 100, and it's going to seat between 2 to 300. Anything over 300 you won't. It's locked, and just to show you that once we're under pressure, this is and it's running. Now, troubleshooting, we're going to troubleshoot the alarms. This alarms right there, the green one, means it's running perfectly at 40. The second one here is that you may have some air in the tubing that needs to be checked. This is the alarm for no water in a warming chamber, and this is temperature is off. Now the alarm in the air chamber is either you have a kinks or you have air in the line. If this doesn't work or this gives you trouble, you can open it and run it without it. And when affected, can we turn it on? On temper. And you can see it's a big water gun. Thank you.